And before we dive into the main topic, could you please share the overview of GSK business in Indonesia today and your current positions and priorities in this country?
Sure. Thank you so much for that question. At this point in time, at GSK Indonesia, we feel very privileged that we have an opportunity to serve this community and this population of over 280 million people. At GSK, we actually are pursuing the innovation which is focused on communicable and non-communicable disease. We are one of the leaders in respiratory diseases with our product, which are listed in Universal Healthcare Program here. And at this point in time, we are also proud to bring innovations in vaccines, especially take an example like herpes zoster, respiratory syncytial virus. These are very innovative vaccines we are trying to bring to this country so that the populations can be protected which are eligible for these vaccines. So our approach is not only treatment, but also prevention proactively, which ensures the productivity and economic growth for the country.
You mentioned about communicable and also non-communicable disease. Can you explain more about what kind of disease that consider it as communicable and non-communicable?
Take an example of infectious diseases like tuberculosis.
Okay.
Those would be a good example of communicable, whereas non-communicable could be any other diseases. Take an example, herpes zoster, or basically other examples are many, but very important from a healthcare perspective that we control the both.
And which therapeutic areas are GSK's main focus in Indonesia?
At this point in time, I said that we are actually ranging from prevention to the treatment. When it comes to prevention, we have herpes zoster, respiratory syncytial virus, flu, and the entire portfolio of vaccines ranging from infants to adolescent to the adult. Whereas we are also prominent leader in respiratory therapy, and we are actually working very, very hard to bring oncology and specialty products, working very closely with Ministry of Health and BPOM. So it is categorized as adult vaccine, then it is categorized as respiratory. Respiratory is primarily important from this country perspective because millions of patients, they have asthma, COPD, and potentially respiratory syncytial virus also, which spreads as an infection or a disease.
But how is GSK Indonesia positioned within the GSK's global network in terms of production, research, and also distribution?
That's an interesting question. So as a global company, we ensure that the global strategies and the alignment when it comes to serving the community and reaching the population are always transitioned to the local operation companies, which is GSK Indonesia. So take an example, when research and development priorities are set, we also consider that where we can create a maximum impact in terms of helping the community and patients. So example, tuberculosis and malaria are the two important diseases for this country. There is an arm of GSK called Global Health, which works very, very closely with the local problems, local researchers to ensure that tuberculosis and malaria can be controlled and can be actually taken care of.
Okay, how do you view the development of Indonesia's healthcare system in recent years, especially after the pandemic era?
Yeah, so look, as a leader at this point in time, when I actually look at any progress, I don't dwell too much into what is the past ranking, are we the lowest in the world for innovation index. We have to be forward looking, and at this point in time, the leadership across Ministry of Health, BPOM, and we have a group of multinationals, which is IPMG. We all work together hand in hand with very clear vision and strategies set out for ourselves. And we all are committed to bring more and more innovative medicines, vaccines to this country. And that landscape is transforming very, very fast.
Okay.
So what I'm saying essentially is, forget about the past, we have made a slow progress, look forward, and what we can do actually in the future is very important. And there are certain significant steps which are being taken in that direction. When it comes to opening the market for innovation, including these innovative medicines through the process of health technology assessment in national formulary, and also making it accessible for free in the Universal Healthcare Program, which is JKN.
But speaking about working hand in hand, I personally believe that you probably would still find a struggle. can you explain more about what kind of struggle that you're still facing in terms of collaborating with the government, with the institution that we have here in Indonesia?
Look, at this point in time, I'm 3 years in Indonesia, and having seen the world, I can actually tell you that from an outside perspective, it is always easy to say what's not happening. But considering the country's size, population, the priorities, and different priorities which government has to handle, at this point in time, I believe we are making a significant progress and step towards including the innovative medicines as fast as possible in universal healthcare. Our commitment as a company, as a group of company, is to work closely, bring the gold standard quality, research and development process, and help the local stakeholders to make these things possible.
What kind of research and development that you do in Indonesia?
So research and development, when it actually comes to, I spoke about tuberculosis and malaria, where our global health is working very closely. At this point in time, we also have a manufacturing site at Pulagadung, which manufactures the inhalers, and this is only one of the 4 sites in the world. And we are very proud that we not only manufacture for Indonesia, but we also export certain respiratory products to the neighboring market.
Okay, so you've been exporting to several countries outside of Indonesia. Can you explain more about which country?
I think those are the business confidential kind of information, but we are proud that we are in a position to actually export that. And this is actually talking about why the local production also is equally important in this market.
Okay, and how does GSK contribute to improving access to medicines and vaccine domestically, especially to the certain area that are very unreachable?
Yeah. So when it comes to basically the size of the country, the supply chain actually becomes a challenge. And how, as a multinational company, we look into it is we bring the best of the best technology. Our quality standards are very high, and ensuring our vaccines and medicines are supplied in a proper temperature and proper conditions, so that the end receiver does not actually have any impact or dilution on the quality front. It is challenging, but sometimes you have to put extra money and resources and capability enhancement to make those things possible. And we are actually, that is why we select our best of the best distributor. We have very high standards and we don't compromise on that.